Hello again. I've been continuing on the discussion or the talks on the cancers and the diagnostic methods. I thought that I will do a couple of talks on the new treatments that have been done. But at the same time, in the future, I want to also do some talks on theology, which is like chakras and the plexus that we know, their impressions and what happens when one meditates and controls over these chakras. But that will be for my future videos. At this time, I'm continuing on the talks on cancers. So I thought I will talk about something called immunity or immunotherapy and monoclonal antibodies that are being nowadays used quite frequently for the cancers and their treatments. Just some basic understanding, the body has a defense mechanism. And if there is an abnormal cell or abnormal bacteria or a virus, body produces antibodies, and the soldiers of the body, the cells, they act quickly and destroy that. So they don't have ability to grow or spread the infection or the cancer, whichever one may be the case. To give you a simple example how this works is like a lock and a key. Every key does not fit every lock. For every lock, there is only one specific key. So the antibodies that are formed are very specific for a particular receptor on a cell. And so a key is very specific for a lock. Antibodies are very specific for only particular bacteria or virus. Everybody knows, especially since the flu season has been going on, is about flu vaccine. So when the flu vaccine is given, the body reacts to the antigen in the flu vaccine and produces antibodies. These antibodies are usually protein, and when a flu virus enters the body recognizes, has a memory, produce antibodies, will act against it and kill it, so that the actual flu as an illness is aborted, prevented, or reduced in its severity. Usually it is reduced in severity. So this is how the vaccines work. Now you got to realize that the vaccines are very specific, which means if there is a person who has received flu vaccine, he will not be protected against pneumonia with a bacterial infection. If somebody has received pneumococcal vaccine, which is the current vaccine recommended for elderly people, older people, people with lung problem, heart problem, etc., it will work only against the specific antigen that they have been injected or incorporated into the vaccine itself. So if somebody has a pneumococcal vaccine, which is the current vaccine, and he gets a different bacterial infection, say staph or strep or any other, that pneumococcal vaccine will be totally ineffective, as antibodies that are developed in the body due to the vaccination will not work against other bacteria, as lock is different. The key, that is antibodies, will not work against other locks or other bacteria or viruses. Knowing this principle, now we go to the cancer. The cancer cells are notorious. They hide from the immunological defense mechanism of the body, and so they are hidden, and the normal body either is incapable of destroying them or not enough to destroy them in quantities that they are reproduced. So the scientists came out with what is called monoclonal antibodies. Monoclonal antibodies are also used for other diseases. So it is not exclusive for cancer treatment. And so monoclonal antibodies are antibodies which are produced in the lab. So these are not the antibodies which are produced in the body, but they are produced outside the body in a lab against a specific antigen. And then these are injected intravenously directly in the blood of a patient who has a particular cancer, where these antibodies will be effective against the antigen that is located on the cancer cell. So you can, again, going back to the same example, the locks are on the cancer cells and a body does not have key to open them. So these antibodies act as a key to open the locks on the cancer cells and destroy them. There are a variety of ways these antibodies are made and used for a variety of reasons. And I would probably venture to say that there are about 7, 8, or maybe even 9 different types of monoclonal antibodies that are actually produced and commercially available. This is called immunotherapy. The variety of antibodies that are produced do job differently. For example, some will directly go to the cancer cells and prevent any protein access that is needed for growth. Some will go there and destroy or damage the covering or the wall of the wall of the cancer cells, and they are destroyed. Some of them go to prevent the blood vessel formation. So as you can imagine, when the cancer cells rapidly multiply, they need more blood, and there is a factor which produces more blood vessels to supply to the cancer cells. So if you use these antibodies, no more blood supply can increase to the tumor, and that naturally lack of blood supply will damage or destroy the cancers. There are some antibodies where they can tag them with a radioactive material. So now it is a targeted radiation therapy through monoclonal antibodies. Sometimes even a chemotherapeutic agent could be added to the monoclonal antibodies, and they will go targeted, or they will go to the cancer cells only and will not go to the other cells. And this will destroy the cancer cells without damaging the normal human cells. So there are many more, and so I think there are total 8 or 9 different varieties of monoclonal antibodies that are produced. Again, as I said, the basic function is to destroy the cancer cells, which body does not have the ability to do it. So it could be in form of direct destruction, indirect destruction by preventing protein access, indirect destruction by preventing blood supply increase, or direct damage related to the radiation or chemotherapy. So these are the varieties of antibodies that are being used. Monoclonal antibodies still have side effects, and most of the people have good tolerance, but they certainly can cause inflammation in the lung. They also can sometimes reduce the blood counts, especially if you're using radioactive isotope being attached to the monoclonal antibodies. But on an average, they're tolerated better. But one has to realize that you have to have a specific lock receptor on the cancer cells for these kind of monoclonal antibodies to be effective. Treatment still is given intravenously. The frequency will be determined by type of the cancers, the stage of the disease, etc. And again, that becomes a very specialized medicine or medical branch. But in general, basic understanding is these antibodies are not produced in the body. They are produced in the lab. They have a targeted function of cancer cells being targeted to destroy them. They do work, but they need to be continued, and they are given intravenously. So essentially, this is the monoclonal antibody treatment or immunotherapy for cancer. And I hope this explains some of the basic thing about monoclonal antibodies. They're being used for a variety of cancers, and certainly a cancer specialist would know exactly which one, how often, what dose, and when they would be effective. So thank you for listening. I hope this is one more step in understanding the cancer therapy. Maybe next time I will go back to talking about chakra and theology, and then again back to medical topic. If you like it, Please subscribe. Thank you. Have a nice day.